can do.
One to 2 teaspoonful of Coflax cough syrup 3 times daily gives you fast relief from chesty and dry cough. Coflax clears your cough and symptoms of cold associated with it. Coflax is available for adults and children. Coflax, the cough syrup for every family. Manufactured by DRUGFIELD PHARMACEUTICALS LTD.
The Nigerian pharmaceutical practice and industry systematically is expanding, diversifying, innovating, and in collaboration with associate industries. The pharmaceutical industry in Nigeria has been estimated to be $1.3 billion, which account for less than 0.25% of the gross domestic product. Effort has increased for local production of drugs, as the nation has ample potential in that aspect, and to make the country a hub for drug production in Africa, especially in West Africa. Healthcare provision in Nigeria is a concurrent responsibility of the 3 tiers of government in the country, while the private providers of healthcare have a viable role to play in healthcare delivery in the country. The pharmaceutical sector of any economy needs attention, and it's as important element like the national security. The health and pharmaceutical sector not only function to provide adequate and timely medical care, but also track, monitor, and control disease outbreak. The sector has been adequately given less attention in infrastructure development and budget provision, hence the medical tourism experience in the country today. The nation's pharmaceutical industry has suffered neglect over the years. Despite Nigeria's strategic position in Africa, the country's pharmaceutical and health is greatly underserved and non-regulated effectively, especially after the Dora-Akunle era. Local production should be encouraged. Banks should give attention to them to boost the GDP and create employment for the teeming youth of our great nation, Nigeria.
Once again, my name is Olakunle Ekundayo. I was born some 63 years ago in Akure, Ondo State. I had my primary education at one of the foremost primary schools in town, St. David's Anglican Primary School. I also had my secondary school education in the town at Aquinas College, Akure. I had a brief stint at the Yaba College of Technology for 2 years. I did science laboratory technology, after which I proceeded to the then University of Ife and read pharmacy at both the bachelor's and the master's degree levels before I started my work career. I worked briefly with Glaxo Nigeria Limited of that time, which is now GSK after a number of mergers and acquisitions, and then proceeded to Pfizer, where I rose to become the production manager in the manufacturing plants. I then left Pfizer to do a pioneering job for Doyin Pharmaceuticals to help set some additional dosage form areas, which the experience I got from Pfizer. So after that, I left to start something on my own, DRUGFIELD Pharmaceuticals. The name came, I would say, by inspiration. I never saw it anywhere, but it just came to me, and I decided to incorporate it. Actually, in 1991, I incorporated it, as a limited liability company while I was still working. So, so by the time I now decided to do something on my own in 1993, then it became handy. So now, manufacturing had been my passion even since my days in the university. I already made up my mind that as soon as I finished a pharmacy degree, I was going to work in the factory. But by the time I decided I wanted to do something of my own, I didn't have money, but I had a skill. And I said to myself, how do I start to do something? So I narrowed down to the least challenging of all the, products, ointments, because I had a skill and I knew it. So that's how I started with penicillin skin ointment in 1993. And I started, and even before I started selling, a friend of mine because at that time Inlax went into pharmaceuticals and they just started. So a classmate of mine was the pioneer marketing manager. So he said, when your penicillin is ready, let's look at it, maybe we can distribute it for you. And that was exactly what happened. I took it there, they said, yes, we'll distribute it for you, we'll pay you after every 30 days. So they gave me the first LPO to bring 5,000 tubes. 2 weeks after, they said, bring 30,000 tubes. By the time I received the first payment, it was over 300,000 naira in 1993. So I said, wow, this is money. I said, let me add other products. I added gentamicin skin ointment, I added Whitfield, and everything was, they were taking it and they were paying. When they say Rome was not built in a day, it is very true. If I did not have the understanding and cooperation of our regulator, NAFDAC, at that time, maybe DRUGFIELD will not be born as a manufacturing company today. What do I mean? At that time, I had a small place, a 2-bedroom apartment, and I went to NAFDAC. I wanted to do ointments. And the head of the technical unit said, well, we know you. You are production manager for Pfizer, so you have a lot of experience. So what you do, you don't have money to set up your own lab, go to Pfizer. If they agree to analyze your raw materials and finished products, and then we'll come and inspect what you have, set up a place for in-process quality control to check weights. And if you can do that, we'll approve you. And I went to Pfizer. And that's why when you work in a place, make sure you don't mess up. I went back to Pfizer and they agreed. They gave me a letter. Yeah. I took it to NAFDAC, at that time, and they came, they inspected and approved the place for ointment. That's how I was able to start. Like I said earlier, we started with ointments. Then we moved to creams. And people used to know us as the ointment company. And by the time the growth, became, quite significant, we started to venture into other more sophisticated dosage form areas. For instance, a lot of even pharmacists, don't realize the fact that creams are probably the simplest pharmaceutical dosage forms to make. Yeah. If you have the know-how, they're the simplest. Ointments, they're the simplest. Now, we move from there to tablets. Because in tablets, you have several equipment to do several unit operations. You mill your ingredients, you granulate, you dry, and several, you mix and all of that. It costs money, to put up the facilities, to bring in the equipment, and then when you are able to set up for tablets, it's easy to add capsules to that, which we did. We moved from there, don't forget, while I was at Pfizer, I made practically all these dosage forms. So I had built up a lot of experience in that. And then, of course, we went into liquids, syrups, suspensions. We moved from there and we started going into sterile products, small volume injectables, eye preparations, eye drops. Then we finally moved into large volume parenteral infusions. So I would say we cover a lot of the dosage form areas: creams, gels, ointments, syrups, suspensions, dry powders, tablets, capsules, eye drops. We're probably the largest manufacturer of eye drops in Nigeria. Small injections like B complex, like paracetamol injection. Now intravenous fluids.
Use Neurogesic if you get back pain, muscle pain, I mean joint pain, rub Neurogesic, good time go warm, go reach deep down, no wonder Neurogesic they really pay, rub Neurogesic, good time go warm, go reach deep down, no wonder Neurogesic they really pay. True, Neurogesic it get power pass pain. Neurogesic na DRUGFIELD Pharmaceuticals Limited they make am.
Nigeria is a middle-mixed economy and emerging market with expanding manufacturing, finance, service, communication, technology, and entertainment sectors. In 2016, Nigeria economy slipped into recession for the first time in more than 2 decades, reflecting adverse economic stocks, inconsistent economic policies, and deepening security challenges in some parts of the country, raising questions for investments for a better economic growth. Nigeria budget execution rate of 51% is not encouraging, as managers of the economy responded to the recession with a package of monetary, fiscal, and exchange rate policies. However, experts have predicted better performance of the Nigerian economy in 2018, with financial analysts saying there will be a tangible improvement in the economy going by the various parameters that support country's revenue sources such as oil and gas, agriculture, and the likes. A source of Central Bank of Nigeria said the monetary policy's rate will be at 14%, cash reserves ratio at 22.5%, and liquidity ratio at 30%, with agriculture playing a vital part in 2018, and especially with raw innovation in biotechnology in agriculture. It is expected that the issue of food security can be well harnessed if well implemented in the budget for 2018.
Well, it's a blessing and an opportunity, to be able to acquire this knowledge over the years and be able to translate it, into what we are today. And I wasn't doing it alone anyway. But as we're going, some of the people we work together at Pfizer, here and there, decided to come on board, to work together, to bring the experience together. Because DRUGFIELD is a 100% Nigerian company. We don't have any foreign partner. No foreign partner, whether technical or commercial or financial, zero. We are all 100% Nigerian company. It's our own from the scratch. But of course, along the line, having worked for Pfizer, I also had the opportunity of meeting some technical people. And right now I have a company, the owner used to be a staff of Pfizer many years ago, an Austrian. He worked for Pfizer International, was building factories for Pfizer in South Africa, in Nigeria here, in Indonesia, in Malaysia, and around the world. So somehow, when I joined Pfizer, we came to know each other, and after that, a relationship developed, and we're like family friends now. So technically, he also offers a lot of advice, gets involved. Many of our new factory designs are done in Austria, actually. Some of our equipment are selected, from Europe, like the air handling units, because some of these are like the soul of the business. You don't want to mess around with, play games with, such things. So we have been blessed in so many ways, That's who we are. at Pfizer had a lot of experience. We made Feldin gel at that time, you know, and I made a lot of it. Now, by the time we saw that adverts in the papers and through PMG Man that USAID, in partnership with USP, United States Pharmacopoeia, were looking for local companies who would show interest in making chlorhexidine gel. At that time, we already had about 4 of our own products in gel form. We have Nirozicam gel, we had diclofenac gel, we had, you know, the one for gum, you know, we had 4 products, at least in gel form. So we just said, oh, this is, you know, our, you know, comfort, you know, zone. So we showed interest. And in fact, immediately we read, you know, and we wrote to them that we started work, you know, because we then knew that it was one of the important essential commodities of the United Nations. So we went on the internet, we saw some work that had been done by Pat and a company, Lomus, you know, and then we saw the formulation was there, you know, very simple product. And then we put things together. By the time the United States Pharmacopoeia, USP, and PAT came to visit us, we were at the verge of producing the product. We had put everything together. They were surprised. And then within a twinkle of an eye, we made a product. We even took samples to the USP office in Washington. You know, they were so excited. The challenges have been many. I mean, I don't want to talk about infrastructure because we all know it, you know, electricity, water, roads, you know. I mean, we have to generate our own electricity, generate our own water, carry our own goods all around the country. But of course, we know how the cost of funding is, how high it is. But I think the most, you know, unfortunate of all these challenges is even coming from our government. Number one, patronage is almost little or nothing. And we all know that government is the biggest spender in this country. And when you even labor and get government to buy some of your products, they don't pay you. You won't believe it that in 2013, during the emergency flood, you know, we got an order to supply the federal government of Nigeria some drugs. And they said, oh, before the end of the year, that was in October, by November you get your money. Up until now, we have not received 1 kobo. So you now ask yourself, what manner of a country is that? We are not the only one anyway. Many of our members, PMG Man, were being owed billions that our own government will buy from us and will not pay us. So how do they want us to grow? How do they want us to survive? When you have to borrow money from the bank at very high interest rate, I think it's unfair. And not only that, there is practically little or no protection. The door is open to anyone to bring in all manner of drugs. You know, when the late Director General, Akunle, was there, she did something which was very patriotic. She said, if you are an importer of finished drugs into Nigeria, she gave 10 years. We give you certificate for the first certificate will last 5 years, we renew it. After that, you must produce the product here. I think it's one of the most patriotic things any Nigerian could have done. But what do we have today? It's been thrown overboard. Not only that, there are quite a number of products that we have more than enough capacity not only to produce for Nigeria, but even the entire sub-region of West Africa, Nigeria will supply without blinking an eye. Some of these, after some lobbying, governments put some restrictions on them. Less than 20 products. We have been pleading and begging to increase this over the years now without success. Ghana, their population is less than 30 million. Ghana has an import restriction of pharmaceutical products, 49 different products. Nigeria has less than 20. That's why this sector is the most endangered now. The pharmaceutical manufacturing sector in Nigeria is the most endangered sector. And unfortunately, people always say after food is drugs, but our leaders are not seeing it that way. Look at what they are doing with food now, rice. They shut the door, and people are growing rice. That is the way to go. India did that many years ago. So why can't we do that with a sector like pharmaceuticals to say, hey, if you have been importing a product into this country for 10, 15, 20, 30 years, and you refuse to, and you are making a lot of money, and you refuse to build a factory here, you shut it out.